This video will overview the SARS-CoV-2 flu RSV point-of-care testing. In this video, we will specifically examine the supplies needed, how to perform a quality control test, how to perform a test on a patient sample, and how to document the results. Prior to completing the test, users must ensure they have donned the appropriate PPE and have assessed the environment. Appropriate PPE includes clean gloves, mask, and a lab coat. Gloves should be worn over the cuffs of the gown, as shown in the image. Gloves must be changed between QC tests and patient sample tests. Lab coats or coverings must be worn at all times during the testing. Lab coats should not be worn outside of the lab. When assessing the environment, please remember, all testing should be performed behind a splash guard or while wearing the proper eye protection. Proper eye protection includes a face shield or goggles. All testing, both QC samples and patient tests, must be performed behind a splash guard or with the proper eye protection on. Testing should occur on the observant surfaces, otherwise known as chucks, and please ensure you have a distraction-free zone. If you have any questions regarding appropriate PPE, please contact your unit super user. Prior to testing patient samples, external QC testing must be performed. QC testing must be performed daily with each new shipment and with manufacturer lot changes. Some of the materials required include the positive and negative controls, 2 cartridges for both the negative and positive samples, 2 pipettes, the splash guard, chucks for your countertop covering, the rack for storage, biohazard trash, cleaning solutions of bleach and alcohol, and a Sharpie for labeling. To begin the QC testing process, users must first log into the instrument. Do so by entering your username and password. Next, on the top right-hand aspect of the screen, select the QC tab. Select Run Negative QC. Please note that the negative sample must always be run before the positive sample. Next, type in NEG into the sample ID. After doing so, scan the cartridge QR code, which is located in the front aspect of the cartridge. You will then confirm the test information as displayed on the instrument. Next, the instrument will instruct you to now prepare the QC cartridge. Leave the instrument and prepare the specimen at your workstation. To begin applying the sample, first open the blue top of the cartridge. Be very careful not to touch the protruding tip in the back of the cartridge. This can lead to invalid test results or a test failure. Prior to applying the samples, label one cartridge negative and one cartridge positive to avoid accidental errors. Next, open up the packaging of your pipette, exposing just the top of the bulb. To begin, invert the negative quality control 5 times. Do not shake the vial. Next, open the negative control, being careful not to touch the inside of the cap. This can be done by holding it between 2 fingers or by putting it face up on your clean absorbing cloth. Next, you're going to use your pipette to aspirate the quality solution. When doing so, be careful to avoid bubbles in the collection space, and try to avoid too much excess spilling into the overflow compartment. Next, you expel the contents into the right-hand corner of the cartridge. When discarding the pipette, please be sure to go around the specimen rack to avoid contamination. Next, recap your quality control solution. Next, you will close the blue cap of the cartridge until you hear a click. Please view the next clip on proper handling of the cartridge. There are a few considerations to keep in mind when testing. Do not touch the clear plastic center of the cartridge cap. This is where the probe enters the cartridge and could lead to contamination of the probe, module, and instrument. Do not deposit the solution into the center of the cartridge. Again, doing so will lead to contamination of the module and the instrument. When using the pipette to collect the solution, be sure to avoid any bubbles. Testers must exercise extreme caution when handling the cartridge. Improper cartridge handling can result in contamination of the entire instrument. Instrument contamination will result in inaccurate result reporting for all subsequent tests performed on the instrument. The top and back of the cartridge must always be avoided. Transport the cartridge by holding the sides, taking special care to avoid touching the blue cap. Click Continue on the instrument to begin loading the cartridge. Place the cartridge in the module that the instrument has assigned. This will be indicated by a green flashing light. Next, close the module. You should hear a click. The instrument will then go through the process of verifying the cartridge. The operator should not walk away while this is happening. Once the cartridge is recognized, a runtime will be provided and the light will turn a solid green. Repeat this process for the positive control, except this time select Run Positive Control. Type POS into the sample ID for positive, as you did with NEG for the negative sample. This is very important. The negative control must always be placed on the instrument prior to manipulating the positive control. The two should not be held in the same hand when transporting to the workstation, and both controls should be stored away from any patient samples. Anytime a positive control vial is touched or manipulated, you must change your gloves. The workstation must be cleansed and sanitized between QC tests and patient sample tests. The station must be sanitized between each and every patient sample test. Both the counter and the splash guard must be cleansed. First, begin with a 10% bleach solution. Then allow the area to dry completely. Next, follow up with the 70% ethanol alcohol solution. Again, allow the solution to dry.
The sample will arrive to the point of care testing area with a patient label. Testers must ensure the work area is clean and that QC requirements have been met and passed for the day. Log into the instrument using your ID and password. Using clean gloves, collect all necessary materials and ensure you are wearing the proper PPE. Place a label directly on the side of the blue cartridge, as shown on the side. From the Home tab in the top right-hand corner of the screen, select the green New Test button. Type the patient MRN into the patient information screen, then select Confirm. Scan the patient label barcode on the sample ID screen and select Confirm. On the Select Host Order screen, the order test associated with the accession will populate. In this example, it is the Expert Express SARS-CoV-2 Flu RSV test. Select the appropriate test. Scan the cartridge QR code and press Confirm. Enter your username and password. Then you will prepare the cartridge, then load the instrument to begin the test.
Begin by opening the blue cap to the cartridge. Next, obtain the sample. Invert 5 times. Do not vigorously shake. Carefully remove the cap to the sample. Using the pipette, aspirate enough of the sample to fill the entire pipette. Avoid obtaining bubbles. Next, expel the contents of the pipette into the large hole on the lower right-hand corner of the cartridge. Be careful to dispose your pipette around the sample tray holder. Recap the sample. Next, close the blue cap of the cartridge until you hear a click. This indicates that it's been properly shut. Click Continue on the instrument to begin loading the cartridge. Place the cartridge in the module that the instrument has assigned. This will be indicated by a green flashing light. Next, close the module. You should hear a click. The instrument will then go through the process of verifying the cartridge. The operator should not walk away while this is happening. Once the cartridge is recognized, a runtime will be provided and the light will turn a solid green. Should a QC test fail, it should be repeated using a new cartridge and a new QC vial. Dispose of the vial used during the fail run. If the QC fails a second time, please contact the instrument's technical support and/or the IDDL lab. Halt patient testing on the instrument until advised further. Patient samples should never be run if 2 levels of a QC, either positive or negative, have not passed. If a patient result fails, rerun using a new cartridge. Should it fail a second time, you will need to recollect the sample. Negative samples must be retained for a minimum of 6 hours at room temperature. Positive samples should be sent to the lab control via the P-tube, along with the ED positive sample sheet, as shown on the right-hand side of the screen. Cartridges should be stored at room temperature between 2 to 28 degrees Celsius. The external quality control must be refrigerated between 2 to 8 degrees Celsius. For any questions or process updates, please reach out to your POCT coordinator or super user from your unit. As always, please feel free to send an email to the CHAMPS Clinical DL with specific questions. From the Home tab in the top right-hand corner of the screen, select the green New Test button. From there, select the appropriate test, SARS-CoV-2 flu RSV. Place the small square patient label on the side of the cartridge. This should not cover the QR code on the front of the cartridge. You will then be prompted to scan the sample, then the patient ID, and then the cartridge ID. After scanning all of the info into the instrument, confirm that your sample label on the cartridge matches the label on the specimen tube. This is particularly important when there is more than one patient sample queued to be tested.